Hello, I'm Dr. Gökay Bilgin from Smile Hair Clinic. Now we are going to show you one of our patients before photos, and we will discuss about his progression in 1 year of time. As you will see now, our patient had hair loss mainly in the front part and the medium section of the head. I will show you a couple of more pictures from the sides that how it looked. Okay, like this. He had also some degree of hair loss in the crown too. As you can see here, his hair loss going back until the crown. Now you cannot see, but these sections of the head, since our patient has combed his hair to this side, looks like covered, but again he has hair loss there too. It's much more visible in this picture. The density of the crown is still enough, but in the some parts there are completely bald sections that we also covered them. I want to show you some photos after the operation. His graft number is 4750, by the way. So again, I want to inform you that the graft number is related about how big your donor zone is and how dense it is. A small sized person, we may have less graft number, but we can have the same coverage as a person with big head. So it's the most important thing that if the extraction done correctly and if the grafts are distributed correctly. I want to show you some incision pictures, if you don't mind. Yes, here. Yes, this is how the incisions are planned in this specific case. Another one here. As you see, these are the micro incisions which will be our patient's hair's new home. So these are taken right after the implantation. We give him a nice coverage, as you see. Of course, in the frontal parts, the density is much more higher than the midsection because he was completely bald in the front and he needed density increase in the sections. What happens after hair transplant? I will show you some photos. This is the healing process of the patient's donor zone. And from the other angle. As you can see, this is still, there's still redness and hair are a little bit tinier than the parts which are not extracted. It's because when we do extraction, we also decrease the circulation of the donor zone a little bit, so that's why the hair growing can sometimes be tiny. For most of the people, this is the most annoying part. You see the recipient zone is red, there are no hair, he had kind of shedding face, and probably he has many doubts in his head that if they are going to grow again or not, if the redness will go away or not. Some people really get desperate in this part and they are not really happy. I will show some photos from the 3rd month. Again, the redness is still there. It doesn't look good. These cuts are still healing, so you can see some small scars. And let me show the donor zone. Yes, it's healed, but not completely. It still needs time. And after 6 months, of course, it started to grow much more faster. Here it is. And now we will see the 1 year results. Here, you can see his frontal line looks really natural and nice. Also, this is a little bit later taken, some time after taken. It's natural, nice, good looking, and if you picture the first look of him and now, we may say that there's a significant age difference between both of them, and he's happy, so we are happy.